Imagine a disease that slowly damages one of your most vital organs. No pain, no warning, no dramatic symptoms. By the time most people discover it, the damage is already severe, and millions are walking around with it right now without knowing. This disease is called fatty liver disease. Your liver is responsible for detoxing your body, processing fat, controlling blood sugar, and keeping you alive. But when excess fat starts building up inside it, your liver slowly stops working properly, silently. There are two main types, one linked to alcohol and another, more common one, called non-alcoholic fatty liver disease, or NAFLD. This second type is the one that catches so many people by surprise. It's not about heavy drinking, it's about the everyday choices we make. Your liver is a workhorse, but when it gets clogged with fat, its performance starts to drop. This sets off a chain reaction that can have serious consequences for your entire body. And the worst part is, you might not feel a thing while it's happening. Here's the scary part. The liver has almost no pain sensors. That means it can be inflamed, scarred, or even failing, and you still feel fine. No sharp pain, no warning signal, just quiet damage happening day after day. Think of it like termites in the walls of your house. They can chew away at the structure for years, and you won't know until a wall starts to crumble. That's exactly what fatty liver disease does to your body. It works in the background, out of sight and out of mind, until the damage becomes too big to ignore. This lack of pain is why it's often called a silent epidemic. Fatty liver usually follows this path. First, fat builds up in your liver cells. For a while, this might not cause any major issues. But over time, this excess fat triggers inflammation. Your body is trying to fight back, but this constant state of alert leads to scarring. This scarring process is called fibrosis. As more and more scar tissue forms, it replaces healthy liver tissue, and your liver function starts to drop. In the most severe cases, this leads to cirrhosis, where the liver is so scarred it can't work anymore, or even liver failure. And most people don't notice anything is wrong until they're already in these later, more dangerous stages. So what are the early signs people often ignore? They're subtle and easy to brush off. Things like constant fatigue that doesn't go away with sleep, a sense of brain fog or difficulty concentrating, some mild bloating or a feeling of fullness in the upper right side of your belly. You might experience unexplained weight gain, especially around the midsection, or just feel low energy all the time. Most people blame these symptoms on stress, a busy work schedule, or just getting older. They think, I'm just tired, while their liver is quietly taking on more and more damage. This disease isn't rare. It's lifestyle-driven. The common causes are things many of us do every day. A diet high in excess sugar, junk food, and processed carbohydrates is a major contributor. Living a sedentary lifestyle with too much sitting and not enough movement also plays a huge role. Of course, alcohol misuse is a well-known cause, but you don't need to drink heavily to be at risk. Even chronic stress and poor sleep can throw your body's systems out of balance and contribute to fat storage in the liver. You don't have to be obese. You just need consistency in the wrong habits for this silent disease to take hold. This is why testing becomes so critical. If you have long-term fatigue you can't explain, if you're struggling with your weight, or if you've been diagnosed with diabetes, insulin resistance, or high cholesterol, you should talk to your doctor. Simple blood tests that check your liver enzymes, along with imaging like an ultrasound, can detect this disease early, long before permanent damage happens. Early detection is everything, because it gives you the chance to make changes and even reverse the condition. Fatty liver disease doesn't scream, it whispers. And ignoring whispers is how silent diseases win. Awareness is your first line of defense. Pay attention to your body, understand the risks, and don't dismiss those subtle signs. Thank you for watching. If you found this information helpful, please like, share, and subscribe for more content to help you stay informed and healthy. This video is for educational purposes only and does not replace professional medical advice. If you have symptoms or health concerns, consult a qualified healthcare provider for proper diagnosis and treatment.